Hello, my name is Helen and I'm the Deputy Director of Kaizen. Today I'm going to present the Plan, Do, Study, Act, or PDSA / bitesize module. So the objectives of the module are to provide an overview of the Plan, Do, Study, Act model for improvement, to explain the different stages of the model, and then to provide examples of where PDSA cycles have been applied at SASH. So to start off with, what is the PDSA cycle? So the Plan, Do, Study, Act cycle is an evidence-based model for improvement. It's a method to identify, implement and evaluate improvement ideas before implementation. So it enables you to test them on a small scale prior to rolling them out. It comprises of 4 key steps, so plan, do, study, act, and it involves small-scale, rapid changes. It's a cyclical process and often you'll need multiple loops of the PDSA cycle in order for you to achieve the outcome. The first stage of the PDSA model is plan. First of all, the opportunity for improvement needs to be identified. And this may be carried out in a number of ways. For example, direct observation on the Gemba may reveal Kaizen bursts, or it may come from rocks in your shoes. The next stage then is to engage the team and try and generate ideas to address this Kaizen burst or opportunity for improvement. So this can be done in a variety of ways using various techniques including creativity and innovation. So things like 7 ways, wordplay, be someone else. Once you've identified your opportunity for improvement and then you've identified a potential idea which you'd like to test, you need to plan the change and predict what will happen. So what's your objective? What are you trying to achieve by implementing the change? Which Kaizen burst are you aiming to address? Do you have any baseline data? Which idea is it that you're using to test? When and where will the idea be tested? So what Gemba? Who will do what and when will they do it? And what data will be collected? So this planning stage is really important because it sets the foundation for the ongoing parts of the PDSA cycle. The next stage is the do stage. So this involves trialling the change on a small scale. Quick and crude is best. What you don't want to wait for is the perfect solution before you start the change, otherwise you'll never get started. During the do stage, it's really important to observe, measure and gather data, because otherwise you're not going to know whether the change was or wasn't effective. It's also really important to gain feedback from patients and staff that the change impacts on. Don't also forget to think about up and downstream of the process that you're implementing the change on. So what impacts does it have on departments above and below the process that you're working on? So key questions to consider at this stage was the cycle carried out as planned? So once you've trialled the change on a small scale, did it go as you'd predicted in the first stage, or did it deviate? Were there any unintended consequences? And at this point, are there any additional opportunities for improvement? So is there anything you want to do to modify your plan in order to improve the next cycle? The third stage in the cycle is study. So once you've implemented your change on a small scale, you need to analyse the before and after data to see what can be learnt. So key things to consider at this point are what changes have occurred in the data? How did the results match your predictions? What new knowledge has been gained by this cycle? And ultimately, is the idea feasible? So this is the key stage to start thinking, actually, could we roll this out, or do we need to modify the idea, and are further PDSA cycles required to test the modifications? The final stage is act. So based on the PDSA stages of the cycle, you're going to formulate an action plan. So key questions to consider at this point are what should be kept, changed or abandoned? Is the idea that we've tested ready to actually implement? Do we need to generate further ideas? Was the idea tested not suitable and we actually need to go back to the drawing board and start again? Are any further iterations of the cycle required? So are we partly on the way to achieving our desired outcome? We're not quite there yet, so we need to go through the cycle several more times. If we're happy that we've got to the point where we want to and it's achieved the desired outcomes and the baseline metrics have changed positively in the way that we'd hoped, then at this point we might want to start thinking about documenting standard work. So this is the best current known way for completing the task. So I'll talk a little bit more about that in a moment. So as we've discussed with the PDSA cycle, you're often not going to get it right first time. You're often going to need to go through multiple cycles in order for you to tweak that idea for you to achieve the desired outcome. And that's totally fine. So in order to support you with the PDSA cycle, there's a PDSA form which helps you document each stage of the process. So this can be found on the SASH intranet site. One cycle is documented per form, so if you're undertaking multiple iterations, then you'd have a form for each of those iterations, which is really helpful so you can look back and see the progress that you've made. So as we discussed, standard work is really useful once you've achieved your desired outcome, because it then documents the new current way of completing the task in line with best known practice. So the benefits of standard work are it allows work to be done in the best way every time. So the new solution that you've been put in place, it allows everyone to be working to this new solution. It ensures improvements are maintained because everyone knows what the new standard work is for completing that task. It's the foundation for ongoing improvement. So when we implement an idea, that's not the end of it. We apply the principles of Kaizen, which is continuous incremental improvement, to continuously refine and progress that idea. Better never stops. And standard work also assists with training, so it assists with colleague onboarding if they're new to an area. You've got a documented method for undertaking a specific task. So now to go on to some examples of where PDSA cycles have been used at SASH. This is an example of where PDSA cycles were effectively utilised during the management of diarrhoea RPIW. So initially there were 7 different stool charts used across the trust. So the aim of the initial RPIW team was to try and standardise some of this information and create one single document which all staff across the trust could use. So they pulled the best bits out of each of the documents to create the new current state. Further, multiple PDSA cycles were undertaken to further refine this form. So visual controls were added in the form of colour to help staff in identifying what the next steps would be for the patient if they presented with a certain type of stool. The information on the front was further simplified to enable it just to contain the necessary information that staff required. During the management of diarrhoea RPIW, it was identified that nursing staff were spending up to 7 minutes gathering the supplies and equipment to attend to a patient who had diarrhoea. They'd need to gather some of the pulp items and supplies, some of the linen supplies to help support the patient. During the RPIW, it was felt actually a solution may be able to be implemented in the form of management of diarrhoea personal care packs, so all of the equipment required to attend to the needs of that patient was in one place to stop the nursing staff having to walk to various different locations across the ward to gather what they needed. So this reduced the setup time from 7 minutes to 1 minute 20. Further refinements of that pack were undertaken throughout the RPIW to review the items in the pack. So it was initially felt that 2 sheets were needed in the pack, but then after further trials, actually it was only felt that 1 sheet was needed. In a subsequent RPIW, the work was built on, and the team felt it would be really helpful to have a male and female pack. So it would have a female nightgown, and the male packs would have the pyjama bottoms in. So this shows how PDSA is such a powerful tool, and it continues to demonstrate principles of Kaizen, continuous incremental improvement. So this example from Clinic Pool List is from a medical records rapid process improvement workshop. So one of the first cycle boxes that was identified when building the medical records value stream was that the supervisors every morning had to print out the pool lists for each of the clinics. The pool list identified which patients were on the clinics, so then the medical records staff knew which notes they needed to pull in preparation for those clinics. Once these lists were printed, and there was often more than 140, these lists had to be manually sorted. They had to be sorted into the different sites that the clinics took place across, so Crawley, Horsham, Earlswood, Redhill. After that, they then need to be sorted into AM/PM clinics. They then further needed to be sorted into speciality clinics. So this process in total took the supervisor every day 40 minutes 32 seconds. So during the RPIW, the team felt that actually there was a better way of doing this. And could the sort actually be done automatically, so the lists would be printed out in such a way that would be in a usable way for the medical record staff to action. So this was trialled during the Rapid Process Improvement Workshop, and medical records have done further refinement on this since, so that now the lists are automatic. It's reduced that need for printing. So it reduced that setup time from 40 minutes to less than 5 minutes, a significant productivity gain. In response to the pandemic, staff had to begin wearing new types of PPE. The Trust purchased some hoods to be used as respirators. So the Trust decided that to add an additional level of clean to the respirators, in addition to the clean that was already taking place in the clinical areas, that a UV process would be implemented. So this involved positioning the hoods in such a way that they could be accessed by the UV light on all surfaces in the minimum time possible, because the idea was to get them back out into circulation as quickly as possible. So the KPO team, along with Infection Control, Estates and Facilities and EME, all came together to try and design a process to optimise the UV cleaning. So the first cycle involved placing the hoods in cages. These cages unfortunately needed to be rotated throughout the process, so the UV cleaning process had to be interrupted, and this took a lot of manual work from the member of staff involved having to rotate the cages. So further PDSA cycles were undertaken, and it was suggested that hanging hoods from metal chains attached to rotating disco ball lights on the ceiling would be a good method to automatically rotate the hoods. This would stop the need for the cages to be manually rotated. In order to access the inside of the hood with the UV beam, the angle of the hood needed to be tipped. So various methods, again using the PDSA cycles, were undertaken to try and find the best way of tilting the hoods to get them into the optimal position. Bags of rice was the final solution that we came up with. They were attached to the front of the hoods using S-hooks, which enabled them to tip the front of the hood enough so that the UV beam could clean all the way around the hood in one cycle. This is a great example of where multiple PDSAs were used and where whole team engagement was also required to come up with the optimal solution. So in summary, the PDSA model is a powerful improvement tool. It consists of 4 key stages: plan, do, study, act. It's important to follow each of these stages in a sequential fashion. Team engagement is key throughout the process in order to get the optimal output. The PDSA cycle enables changes to be rapidly tested on a small scale prior to wider implementation. Multiple iterations of the cycle may be required. It's very unlikely that you'll get your perfect outcome following the first cycle. And improvement is not about having the perfect solution immediately. It's about trying things out, and this cycle enables you to do this.